Howdy, my name is Tom Weiss. I'm a geriatric psychiatrist, and I've been privileged to be asked to give a presentation today with a rather attention-getting topic called Taking Care of the Hateful Patient. I was trained by Jesuits, and they insist that whenever I do a presentation, I have to tell a story or two, and I must introduce pieces of history, or I'll be struck down by a Jesuit lightning bolt. So we'll begin with a wee story. You heard about the Georgia Peach, a woman in Georgia. It was a lovely Sunday afternoon, sunny, blue skies. She decided to go for a drive in the country. She's cruising along, and she gets to a bridge over a large river there in Georgia, and she spies this young man, about 25. He's perched on the bridge railing, and she immediately pulls over to the shoulder and jumps out of her car because it looks like he's going to jump off and take his life. And she yells to him, "Please don't jump. Think of your wife and children." And he yells back at her, "Lady, I'm not married, I don't have any kids, I'm jumping." So quick thinking, the Georgia Peach yells out, "Please don't jump. Think of your mother and your father." And he says, "My parents are dead, I don't have any brothers or sisters. Leave me alone, I'm jumping." And then finally, out of sheer desperation, the Georgia Peach yells over, "Please don't jump. Think of Robert E. Lee." And the young guy, he's peeved, he's irritated, but now he's puzzled. He looks over at her and he says, "Who's Robert E. Lee, lady?" And she yells back at him, "Why don't you jump, you Yankee SOB?" So I tell that story because it's a lovely example of what we in psychiatry like to call counter-transference, meaning the feelings that the physician or the caregiver has toward the patient during the encounter. And here's this Georgia Peach trying desperately to rescue this young man, and she's rebuffed, and then finally at the tail end she kind of reveals another side of her, kind of a human side. That's why we grin. So the title today is fairly politically sensitive. In fact, I was worried that Morningside Ministries might want me to take out the word hateful and substitute the adjective difficult. But instead, they told me that they actually worried more about the word patient. And they debated it, and long story short, they decided to keep it. And I'm glad we did, because when I started my fellowship training, the very first day that I met my mentor, he asked the other two fellows and myself, day one, minute one, he said, "What's the origin of the word patient?" And of course, none of us knew. So we got our first homework assignment before 30 seconds had passed. And if you look up the word patient, you'll discover it's from the Greek, and it's simply to suffer, to suffer. And all of us, when we've been unwell, physically or emotionally, very few of us, when we're unwell, are at our best. It's often said that doctors and nurses in particular make the worst patients, and I think that might be true. And of course, when we're not at our best, it's pretty difficult for other people to love us, sometimes difficult to even like us. But we're not going to talk today about the occasional personality clash between a care provider, a clinician, a physician, and their patient. But we're actually going to talk about patients that kindle dread. But we're going to try and make this very productive. As you can see in my subtitle, this very short slide review is going to be a guide to enlightened hatred. So remember the Jesuits, they insisted that I always introduce pieces of history. So in 1682, a now famous English physician named Thomas Sydenham. He's probably most notable for describing in impeccable detail a neurological condition that today bears his name, called Sydenham's chorea. But in 1682, after working with a population of what in those days were called hysterics, these were difficult patients that were impulsive, unpredictable, and would evoke a lot of negative feelings, Dr. Sydenham wrote the following quote, and you know, it's just beautiful in the prose. It makes me wonder why we don't write this way anymore, but I mean, it says it all in a sentence. With this population of difficult patients 330 years ago, he said, all is caprice. Translation, anything's going to happen here. It's very unpredictable. These patients, these hysterics that he's treating, love without measure those whom they will soon hate without reason. So here's a patient that it starts off lovely, but very quickly becomes very, very ugly and difficult. And, you know, if you can read between the lines here, I think what you detect from Dr. Sydenham 330 years ago is a bit of bewilderment and trying to figure out what to do with these folks. So this isn't something that started last year or this century. This is part of humankind and caring for one another.